Welcome, ladies and gentlemen. Welcome to the show. I'm John Robert Cruz, and today we are at the Empire Medical Services office in Queens, Flushing, Queens, to be exact. Today we are going to be interviewing Dr. Chakoti, who is an internal medicine doctor certified by the American Board of Internal Medicine. Dr. Chakoti is the executive medical director and CEO of Empire Medical Services and Heart Docs LLP. This organization has 4 offices in the New York City area, 2 in Queens, 1 is in Flushing, 1 in Rockaway, and another one in Brooklyn, which is in the Mill Basin area, and another office in the Manhattan area by Columbus Circle, approximately around 59th Street. Today, once again, we're interviewing Dr. Chakoti, and Dr. Chakoti, I'd like to welcome you.
Thank you very much. Glad to be here.
Yes, Dr. Chakoti, we've been trying to arrange an interview with you about your practice in Empire Medical Services for the people who need quality care. So I want to educate the people as best as humanly possible on you and everything that's offered here at Empire Medical Services. Dr. Chakoti, our viewing audience would like to know what exactly is an internal medicine doctor?
Internal medicine is a medical specialty which focuses on the diagnosis, treatment, prevention of the non-surgical conditions in adults.
Okay. Diagnosis, treatment, and prevention of non-surgical health problems in adults, specifically internal medicine, correct?
That's right.
Okay. Could you tell our viewing audience what hospitals were you trained in?
I was trained in Elmhurst Hospital, affiliated with Mount Sinai School of Medicine, Westchester County Medical Center, affiliated with New York Medical College, and Long Island College Hospital, affiliated with Downstate Medical Center, Brooklyn.
Okay. How long have you been practicing medicine overall, your full career?
I've been practicing medicine almost like 32 years.
32 years?
Yes.
Could you name, how long have you been practicing in the United States?
I was last 12 years.
The last 12 years straight?
Right.
Have you ever practiced in, I would imagine you practiced in other countries then, right?
Yes, I did. I practiced in England, India, and Ireland.
You mean England, India, and Ireland?
That's right.
Wow, so that encompasses about 20 years in those other countries.
That's right.
Very interesting, very interesting. Now, Dr. Chakoti, you are an internal medicine doctor, but I see that your practice also deals with overall family health issues for all ages. Is that correct?
That's right.
Okay, so you have other doctors on staff also, correct?
That's right. That's right.
Okay. Now, at Empire Medical Services, you deal with different aspects of medicine. Can you describe, I think if I'm not mistaken, I was looking at some of your literature, you deal with cardiology, physical therapies, neurology, and gastroenterology. Can you describe the basics of cardiology treatment that a patient can receive here? And what symptoms if they have some symptoms, why should they come here? Tell me a little bit about the cardiology treatment.
Our office is like a broad-based interdisciplinary medical office, which you have cardiologists on the staff, and we are affiliated with NYU Medical Center. And the patients who needs cardiology services are patients who have a chest pain, heart attacks, high cholesterol, high blood pressure, these kind of patients, they need the cardiology services. We provide all comprehensive care in our offices like EKGs, echocardiograms, stress tests, and this all encompasses a lot of cardiac conditions. And if they need to go to the hospital, we have the cardiologists who are affiliated with the NYU, as I said earlier. We can take the patient to those locations.
So are you
which they get the best medical care.
So are you also telling me that a person with cardiology issues, if they come here, they don't have to bounce from one clinic to another, getting all kinds of tests? They get one-stop shopping here?
That's right. That's right.
Okay. All right. Welcome once again to the show. Today I'm interviewing Dr. Chakoti, who is the Executive Medical Director and CEO of Empire Medical Services and Heart Docs LLP. Dr. Chakoti, let's continue with the interview. I understand you also do several other things here, like physical therapy. What types of physical therapies do you offer here?
Patients who who have neck pain, back pains, knee pains, we have a pain management and rehabilitation doctor on the staff. He evaluates the patient first. Then subsequently we refer the patient to the physical therapy, where we have an exercise program and ultrasound, electrical stimulation, so forth.
So sometimes people may have an accident too, right? And they can be referred here by maybe a lawyer or something like that, am I not mistaken?
Yes, they can.
Okay. So we're talking about also arthritic conditions, correct?
That's right. That's right.
Okay, so if somebody's knee is clicking, should they come over here?
Yes, they should. We have an excellent pain management doctor on the staff, and he gives the knee steroid injections, that kind of, and at the same time we rehab them so that they'll have less pain, and we give the pain medications. We make sure that they get the best treatment.
Okay. Now, I also noticed in your literature that you have a neurology center. Now, what is the neurology center and what kind of treatment does that entail?
We have a neurologist on the staff and who takes care of headaches, migraines, sciatica, slip discs, pinched nerves, and epilepsies, dementias, seizure disorders, and especially like we are specialized in carpal tunnel syndrome too.
The wrists, right?
Right.
All right, okay. Now, I once went to a gastroenterologist. I was very unhappy with the treatment I received somewhere else. But if I wanted to come here, I see that you also do gastroenterology. A lot of people don't understand what the term means. Could you explain what the term means and what type of treatment they would get here for those
Basically,
kinds of
the
issues?
gastroenterologist is a specialty in itself where they treat with the heartburn, stomach pains, ulcers, rectal bleedings, pancreatic disorders, and nowadays the patients usually 50 and above, they need the cancer colonoscopy screenings. We do all those things at our center.
You do colonoscopies here too?
We don't do, we have doctors whom we refer to.
Okay.